Hi there, I'm Professor Anne Tiedemann from the Institute for Musculoskeletal Health and the School of Public Health at the University of Sydney. I'm also one of the co-founders of the Fall Prevention Alliance Australia. In this series of 3 short presentations, I'm aiming to raise awareness about falls in older age and what we can all do to prevent falls. So in this first session, I'll be talking about risk factors for falls. So it's all about understanding why older people are more susceptible to falling and the things we can all look out for as a first step in opening conversations about falls and putting in place strategies to prevent falls. So let's get started with a brief general background about falls in older age. Before I begin, I'd like to acknowledge the traditional owners of the land on which I am today, the Wongal and Gadigal people of the Eora Nation, and I pay my respects to elders past and present. So, falls in older age are very common. We know that for people aged 65 and over, around 1 in 3 will fall each year, and many of these people will have multiple falls. For older people, once reached around age 80, around 1 in 2 people experience a fall every year. The statistics also show us that around 400 Australians in the 65 plus age bracket have a fall that puts them in hospital every day. This is the equivalent of 8 packed buses or a full assembly hall. So that many people are being admitted to hospital every day. More than 6,000 people die from a fall every year in Australia, and that's the size of a local football stadium. And falls account for around 17 deaths per day in Australia. So there's a massive personal cost of falls to the older person, their families, their communities. And there's also a huge economic cost, which has been estimated to be around $3 billion each year. And unfortunately, these statistics are getting worse. We have an ageing population and we know a lot about fall prevention, but the effective strategies and interventions are not being implemented well. So we need to do a lot better in this regard. So as I said, falls are important. They have a massive impact on society, health services, our loved ones and us. It's important to note that deaths from falls are much higher than the number of deaths that occur from other commonly accepted injury types, including road traffic accidents. Another statistic that's quite alarming is that there's 1 fall-related visit to an emergency department by an older Australian every 2.5 minutes. And unfortunately, after having a fall, people are twice as likely to have to be admitted to aged care as people hospitalised for other reasons. Now, it's not all bad news. We know a lot about how to prevent falls. So we know that appropriate exercise, home safety modifications, and regular health checks can reduce falls by around 30% within 12 months. So it's not all bad news. There's a lot that we can be doing to encourage people to take action and to prevent falls. It's also important, I've let you know that falls are common in older age. It's currently around 1 million older Australians fall each year, but it's really important to note that it's not just frail older people who have falls and who have serious consequences as a result of those falls. You can see some famous Australians shown here on the screen who've all suffered falls in the past few years. Most recently, Maggie Beer, who had a hip fracture as a result of a fall. But sadly, we've lost some famous Australians due to falls. Those included Carolyn Jones, the journalist, Carla Zampatti, the fashion designer, and Barry Humphries, the entertainer. And I like to point these people out because they were all still active, relatively healthy older people who were still working and contributing to society. They were not frail older people who fell and then consequently died. So this is really important because serious consequences can come from falls for anybody. So again, we need to take action. We need to be preventing the first fall, and we need to not be waiting for someone to fall before we think about strategies around prevention. Okay, so why do people fall? So we know that falls are more common in older age. Falls are complex, but we do understand a lot about the risk factors, and this can help us to then implement effective prevention strategies. It's good to conceptualize a fall as occurring when a person's physiology can't cope with the task that they're undertaking within the environment at the time. And so falls are complex. They happen because of our bodies, our decisions, and our surroundings. And we know that it's more likely for a fall to occur in older age because there's different factors that are influencing our physical capacity to withstand a fall. So we know there's certain medications, the aging process, and diseases that can impact on the physical factors that are associated with falling, such as reduced balance, low leg strength, poor vision, reduced sensation, slow reaction time, and other cardiovascular factors. So they're the physical factors that are associated with the fall. We also know that behavior is important. So the choice of behavior, so a person's cognition can impact on that. A person's insight or their risk-taking attitude has an impact on their behavior and hence can put them at risk of falling. And how distracted we are while undertaking a certain activity, this is also implicated. And then finally, our surroundings are important. There's many environmental hazards that can cause trips and slips, for example, and can then lead to a fall. So falls are complex. There's a lot of factors that are at play when a person falls, but there's several of these factors that we can actually intervene with and reduce the risk of falling. So just to summarize, I guess, falls happen because of physical changes. So our bodies change. We have, as I said, decreased muscle strength, reduced balance, our vision declines, we're slower in reacting. So if we trip on a crack in the pavement when we're older, it's going to be harder for us to react quickly and to keep ourselves upright. Important factors that influence our physical capacity are things like physical inactivity, certain medical conditions such as dementia, stroke, diabetes, Parkinson's are all associated with a higher risk of falling, and some medications are also implemented in the risk of falling. So our decisions are important. So they play a part in whether or not we will fall in any given situation. And again, like I said, these decisions are influenced by our cognition, our insight, our attitudes, and how distracted we are at that time. We can see some common behaviours that are often associated with a higher risk of falling: rushing for the telephone, climbing a ladder and doing risky behaviours on ladders, and walking downstairs without holding onto the rail if you've got impaired mobility. And then finally, our surroundings. So there's several examples on the screen here of risky situations where a fall could occur. So it's important to be trying to reduce these risks, but we can't always move about in a safe environment. So we will meet hazards in our environment, and that's why it's important to try and improve the physiology to manage those hazards and to cope with the hazards that we are likely to encounter. So falls can have a devastating impact on older people and their families. So I've talked about, the 17 deaths per day, but even if people have minor injuries as a result of a fall, it can set in place a downward spiral. So the injury occurs, there could be ongoing disability as a result of that fall-related injury. This often leads to social isolation. People tend to reduce their activity levels, they lose confidence, And this in turn sets in place this cycle of reduction in community participation. People have trouble doing their everyday activities because they become deconditioned. They may be fearful of falling again, so they do less and less. And of course, unfortunately, this places them at higher risk of having another fall, this deconditioning and this reduction in activity. And as I said, a fall often leads to residential aged care admission. So again, it's important to intervene early. Don't wait for that first fall to occur before we talk about fall prevention. So we have clear evidence about how to prevent falls. We know what to do. We just need to be implementing that evidence in a more streamlined and consistent manner. The World Falls Guidelines were released back in 2022. They give clear guidance about strategies that are effective in preventing falls, and I'll talk about them in more detail in the next presentation. But what's important is the 3 key questions that are suggested to be asked in the World Falls Guidelines. So the 3 key questions are: has the person fallen in the past year? Do they feel unsteady when standing or walking? And do they worry about falling? And if a person indicates yes to any of these questions, this is an indication of increased risk and the need for further evaluation. Now, even if a person hasn't fallen in the past year or doesn't have these doesn't say yes to these other questions, the recommendation is for all older adults to undertake at least community-based exercise to improve strength and balance. So we should be recommending that to all older people, regardless of whether they've fallen or not. We also have updated Australian fall prevention guidelines that came out in 2025. They use similar evidence to the World Falls Guidelines, and they have similar recommendations, and I'll talk about these in the next presentation. So just to conclude, we know a lot about risk factors for falls, but what's important is we need to be talking about these risk factors. We need to start opening up and having a discussion with older people around their risks for falls, and that's the focus of April Falls Month this year. The campaign is all around talking about falls and breaking the stigma around talking about falls. So we need to be opening up that conversation, and particular signs that you can look out for are listed here on the screen. So unsteadiness, signs of feeling unwell or noticing bruising on an older person's body, noticing that they're having trouble being mobilizing safely, holding onto furniture while moving about can be one indication. That's indicating that people are becoming unsteady on their feet and needing to take some steps to improve their balance and strength. And confusion is another sign that people can be at risk of falling. So it's really important to be looking out for these signs, talking about it, having a conversation, and taking action early. So my take-home messages are that falls are common in older age, and they can be life-changing and life-ending, unfortunately. Falls have a huge cost to individuals, society, families, and the health system. But many falls are preventable. So you need to start the conversation early. Don't wait for the first fall to occur before you think about prevention and before you open up that conversation. So thank you for your attention. I just wanted to point out 2 resources here. If you want to learn more about fall prevention, the Falls Prevention Network offers workshops. You can see the link here on the screen. And if you wanted to help to spread the word about fall prevention, my colleagues and I have formed the Falls Prevention Alliance Australia as a way forward in terms of spreading awareness throughout the community about fall prevention, but also advocating for greater support and policy action on falls from the government. If you'd like to contact me, feel free. My contact email is there. Thank you.